Age Alliance Wales, tackling ageism, strengthening prevention and keeping people safe. Introduction and context. Wales is one of the fastest ageing nations in the UK, with projections indicating that by 2030 over a quarter of the population will be aged 65 or older. This demographic shift presents both challenges and opportunities for policymakers, service providers and communities. Longer lives are a success story, but they require proactive planning to ensure dignity, independence and equality for older people. The manifesto emphasises that older adults contribute significantly as carers, workers, volunteers and community leaders. Yet they face systemic barriers in health, housing, social connection and financial security. These challenges are often exacerbated in rural areas where access to services is limited. The overarching message is clear. Wales needs a bold, coordinated approach to adapt policies and services to meet the needs of an ageing population. This includes tackling ageism, strengthening prevention strategies, and ensuring safety and well-being for all older citizens. The context sets the stage for why Age Alliance Wales calls for urgent action from the next Welsh Government to prioritise ageing issue in its agenda. What positive ageing means. Positive ageing is about more than living longer. It's about living well, with purpose, dignity, health and social connection. When older people are supported to age positively, they experience improved well-being, independence and inclusion, while communities benefit from their skills and contributions. Positive ageing reduces pressure on public services and fosters stronger, more compassionate communities. Achieving this vision requires age-friendly environments, access to suitable housing, transport, healthcare, lifelong learning and support services. Tackling ageism is central to this effort, as harmful stereotypes and systemic biases undermine older people's rights and opportunities. Age Alliance Wales calls for a national vision that prioritises inclusion, well-being and independence, ensuring that older people are recognised as individuals with rights and are treated with respect across all sectors. Key issues facing older people. Older people in Wales face significant challenges in accessing health and social care services. Health concerns include delays in elective surgeries, poor hospital discharge practices, and inadequate safeguarding measures. Co-production with older people and the third sector is essential to improve outcomes, yet services are often designed without their input. Mental health is another critical area, with barriers such as loneliness, bereavement and ageism leading to symptoms being dismissed as just getting old. Services remain geared toward younger adults, and older people encounter long waits, limited age-appropriate therapies, and digital exclusion. Social care access is equally problematic, with workforce shortages and lack of pay parity with the NHS threatening quality. Prevention must be central to social care strategies, as early support sustains independence and avoids crises. Unpaid carers also need recognition and support through respite and practical assistance. These issues highlight the need for systemic reform to ensure equitable, inclusive and proactive health and social care for older people. Financial insecurity is a growing concern for older people in Wales, with rising living costs forcing many to cut back on essentials such as heating and food. Around 70,000 older households miss out on pension credit, which unlocks other vital entitlements. Low fixed income limits access to healthy food, warm housing and transport, while rural isolation and poor digital access deepen inequalities. Housing quality is another critical issue, as warm, safe and accessible homes are essential for health and independence. Poor housing conditions contribute to falls, illness and hospital admissions, while integrated housing and health strategies can ease pressure on hospitals and build resilient communities. Safeguarding is a cornerstone of safe ageing, protecting older people from abuse, neglect and exploitation. Over half of older people in Wales fear abuse or isolation. Underscoring the need for proactive measures such as staff training, accessible reporting systems and public awareness campaigns to challenge ageism and promote respect. Our calls to action for an age-friendly Wales. We've identified 5 policy priorities, and Age Alliance Wales urges the next Welsh Government to commit to these priorities. The first is to challenge ageism and to protect rights by implementing systemic approaches, including a dedicated ministerial lead, mandatory training and national awareness campaigns. Secondly, we're looking to strengthen communities and participation by expanding community-based services and mandating co-production with older people in service design. Thirdly, we want to ensure accessible health and social care through equitable access, investment in the social care workforce and robust support for unpaid carers. Fourthly, we'd like to see secure financial well-being and advice by guaranteeing accessible advice services, proactive outreach for benefits and integrated poverty reduction into ageing strategies. And fifth, to deliver sustainable funding and accountability by committing to multi-year funding for statutory and third sector services, ensuring resources for age-friendly initiatives and embedding measures for co-design and compliance. Together, these actions aim to create an inclusive, age-friendly Wales, where rights are respected, communities thrive and services are sustainable. Next steps. Age Alliance Wales has set out a clear vision for an inclusive, age-friendly Wales, where older people can live safely, positively and with dignity. Achieving this vision requires bold leadership, systemic change and sustained investment across health, social care, housing and community services. Tackling ageism, strengthening prevention and embedding safeguarding are not optional, they're essential to ensuring equality and well-being for all older people. The calls to action outlined provide a roadmap for the next Welsh Government to deliver meaningful change. Members of the next Senedd have a critical role to play in championing these priorities, engaging with stakeholders and ensuring that ageing issues remain at the forefront of policy discussions. Together, we can create a Wales where ageing is celebrated, rights are protected and communities thrive.